Vinaka, and welcome back to another episode of Oceania Hospital's Health Talk. I'm your host, Rusila, and today we'll be looking into the pediatric care, and we'll also be focusing on neonatology and different admissions for pediatric intensive care unit and neonatal intensive care unit. Joining us for the second time today is Dr. Madhav Aryan, who is our head pediatrician here at Oceania Hospitals. He will be helping us understand the differences and also understanding the term, which is neonatology. So before we get right into it, a big Vinaka to all our viewers out there. Thank you for the likes, views, and subscriptions, especially on YouTube. And again, thank you for joining us today, Dr. Aryan. How are you this morning?
I'm good, thank you. And good morning to all viewers.
Okay. So would you just explain to the viewers what neonatology is and how it's different from general pediatric care?
So when we talk about neonatology, it's a subset of pediatrics. And normally when we say it's that scope of pediatrics is from the time of birth till 19 years of age. Different countries have different cutoff points, and here we see patients up until the 15th year of their life. So neonatology is that particular subset which deals from the time of birth to the first 28 days of life, which means that all babies who are born within and from the time of birth to the first 4 weeks of life, they would be considered to be neonates and would be coming to us for neonatal care.
Okay. So what kind of babies need to be admitted at neonatal intensive care unit or NICU, and what kind of care do they usually receive?
So the neonatal care is in various grades, level 1, 2, 3 and upwards, and they again have various subsets. What we provide in Oceania is a level 3 care. So a level 3 care means that you have a neonatologist on board, which is myself, and trained neonatal staff, and which includes doctors and nurses. And we need to have certain equipment, and we need to fulfill certain criteria which we meet with. We do not have pediatric surgical facilities, so we cannot grade ourselves higher on the scale. Now, when we talk about neonatal care, it starts right from problems which arise from before birth, which usually means that there can be a genetic or a chromosomal problem which the baby inherits from either or both parents, or it can be what we call as inborn errors of metabolism. Putting it in simple English, it means that certain chemicals or certain enzymes are not working well. And this also is an inherited problem, and these children usually do not do well. So the third subset of categories are problems arising at birth. There can be a complication at birth. Either the baby gets stuck, or the baby comes out late, or there's a cord, something wrapped around the baby's neck. Or in a more developing part of the world, we see that where the babies have not been monitored adequately prior to their birth, and there's a complication at birth, which fortunately in our country, it's rare. And we have babies who fall sick because they have acquired infections from the mother, especially in the last 7 to 10 days of their pregnancy. Some of them can be born with cardiac defects and other defects. So the scope of neonatal care or admissions into NICU is huge.
Okay, so on the same line, how is PICU different from NICU, and what types of children are usually treated there?
So in pediatric intensive care, we admit all babies who are older than 4 weeks of life, 1, and 2, they can either be inborn and then they come back to us for review. So they are people who come in from the community. And in most centers, including ours, because we are still at a nascent or a developing stage, any baby who's born outside and then they need even neonatal care, that means care within the first 4 weeks of life, we admit them into the pediatric intensive care unit. This is mainly for infection protocols, control protocols, because we don't want inborn babies, that is babies born inside a sterile environment, inside the hospital, to be interacting with babies who are born in a relatively unsterile environment, medically speaking, from outside the community. So all children up to 15 years of age and who seek urgent medical attention, or what we say as critical medical attention, are admitted in the pediatric intensive care. Children who are less sick and who do not need monitoring or intensive treatment, they are admitted to the wards.
Okay, thank you. So I know you've explained it a bit there, but what would be some other common reasons why a baby or child might need intensive care in NICU or PICU?
Come again?
what are some common reasons that the baby or a child might need intensive care in the NICU or PICU?
So in the neonatal intensive care unit, what we observe in our hospital, most of the mothers who come in are mothers who have been carrying infection, or rather the baby has contracted infection from the mother prior to delivery. So these are the babies we admit here. Some of these babies also have developed jaundice or a newborn jaundice, or neonatal jaundice as we call it, and this is usually because of blood group incompatibilities. We also deal with some premature babies, which I forgot to mention earlier, and these premature babies often need intensive support. The smaller they are, the tinier they are, the earlier they come out, they need more care. So we need to monitor their lungs, especially the lungs is an organ which usually doesn't work too well, and we need to monitor the heart and other systems. So these are some of the babies we commonly admit in our neonatal intensive care unit. That is one. From a point of view of the pediatric intensive care, the current admissions which we are having in our hospital are basically related to complications of dengue fever, which there's a lot of it going around. And we have, again, a very seasonal diseases. We have a lot of pneumonia patients suffering from pneumonia or lung infections. And of late, we have also been receiving a lot of children who are coming to us with kidney failure.
Interesting. So, with the changing seasons and illnesses going around that you've mentioned, what advice do you have for parents to help keep their newborns and children safe and healthy?
So, as I tell all my patient caregivers when I meet with them, including one which was born yesterday, that they need to wash hands because the baby is relatively immunocompromised compared to older children because their immunity is not well developed. So, what would happen is that the more you handle the baby and more unclean your hands are, the more likely that the baby is likely to pick up infection. Anybody who has a cough or a cold, or what we call as a head cold in layperson terms, they should not even be in the same room as the baby. And if the mom has to breastfeed, which she has to, she needs to wear a mask, feed the baby, and then let somebody else take care of the caregiver part. If daddy has an infection, he should not even be in the same room as the child. Usually the point of entry of infection is a school-going older sibling who is a school-going child who picks up infection at school and then comes back. We do not recommend kissing, facial kissing, or we do not recommend kissing on the hands of the baby, and that kissing should be permitted only to parents. The other children in the same house, grandparents and relatives and friends should not kiss the baby and preferably avoid handling them.
And that wraps up another episode of Oceania Hospital's Health Talk. Thank you, Dr. Aryan, for enlightening us on neonatology and the different admissions for PICU and NICU. To our viewers, I hope this was insightful, especially for the parents and caregivers out there. Once again, thank you for everyone joining us today. Until next time, this has been Oceania Hospital's Health Talk. Naka.